Good afternoon. I just want to thank you all for coming and for the continuing concern for Rick as he recovers from Ebola virus disease. As we've released information each day, you've seen that he is steadily improving. We're so appreciative also of the attention and professionalism of the biocontainment unit team here at the Nebraska Medical Center. We've been cared for on every level by the physicians, the nurses, the administrators, everyone at this great institution. Nebraska really should be proud. We really are amazed at how quickly Rick's condition seemed to turn around after he was admitted on Friday. As his friend Kent Brantley said on national TV that very night, we attribute his recovery also to both faith and science. Rick asked me to say that he is humbled and overwhelmed by the words of kindness and support that he has received since his diagnosis with Ebola virus disease. Our old friends from years past, new friends whom he has not met, and a long list of those who've supported our mission work for over 25 years have all joined in a mighty chorus of prayer on his behalf. These prayers have made him know that God is near, and they have sustained him. We thank God for his mercy in preserving Rick's life, and we are also thankful for the research, drug, and excellent supportive medical care that was available because he could be evacuated. Most of all, we hope that what is learned from Rick's and his colleagues' illnesses can open up viable possibilities for the treatment of Ebola in West Africa, where the suffering is now extending far beyond the victims of the virus itself. Rick went to Liberia at the beginning of August because he could see that the Ebola crisis was setting off a domino effect in the Liberian healthcare system. Not only was there inadequate medical care for those with Ebola disease, but patients with common health problems were not getting treatment. His patients with high blood pressure would not be filling their prescriptions. Those with diabetes would not be getting their blood tests. And parents were going to lose their small children to malaria because there was no place where they could get the IV drugs they needed. When Rick arrived at the beginning of August, there was not one box of rubber gloves, of latex gloves, to be purchased in the entire city of Monrovia. So clinics and hospitals really almost had no choice but to close their doors until some protective equipment could be available to them. Rick himself had to go all around the city to hardware stores to find boots with which he could supply his obstetrics and his OR staff so they could be protected in that way when they were doing their work. The first week the hospital opened for obstetrics only, they received a dozen women who had been to multiple hospitals after long and unsuccessful labor, and none were able to get a cesarean section at those places. By the time these women arrived at our hospital, only the mothers' lives could be saved. Rick was really heartbroken. Now, I know I'm speaking a bit long and you have a lot of questions you want to ask, but we want people to understand what is really happening in Liberia. We appreciate all the attention and concern for Rick, but he wants you to share his burden for the people of Liberia and West Africa, to carry it along with him. We appreciate that many have given to our mission and many other organizations to make sure that health workers have protective equipment. But the fight against this crisis is going to take more time and resources. We in America enjoy many benefits from globalization, and we'd like to think that we can isolate ourselves from a situation like this, like the one in Liberia. But every day and every week that we don't do what we can to stop Ebola in West Africa, we are risking the possibility that Ebola will not stay in West Africa. Thank you. So I guess we're going to take some questions, and I mean, I don't really know how to manage this.
I'm Laura McCabe with
Okay.
ABC News.
All right.
As you are aware, and I'd like the doctors to chime in on this as well, but first you, NBC News recently broke the news that Rick received a blood donation from Dr. Brantley. And I guess I'm wondering what that means to you to have him here, and what it meant to your husband, and the doctors if they could address the medical issues surrounding it.
Well, I didn't get to see Kent. He was here before I got here. And it really meant a lot to us that he was willing to give that donation so soon after his own recovery. And I spoke with his wife before it was arranged, and we both marveled at the fact that they had the same blood type. That was just, to us, that was something from the Lord. However, since they're so alike, we often thought that they were. But they can speak to any of the other medical issues.
Yeah.
Yeah.
Could you say how Rick reacted to having?
He was blessed. He didn't find out till he was not able to like interact with Kent when he was here, but he was blessed and you know felt the same way we did when we found out it was a match. It was pretty special. So.
Yeah. This is a form of therapy called convalescent therapy. Convalescent transfusion plasma was taken from a donor who had recovered, therefore presumably had antibodies against the virus that Rick had not yet had time to develop. And 2 separate transfusions were harvested and given with no difficulty whatsoever. So in the absence of proven theories, proven antivirals for Ebola, we thought we wanted to try everything we could, and that worked out very well. The first donor we tested was a mismatch, and we were down to our last shot, so we said, uh-oh, but worked out great.
Yeah, we were blessed. Another question?
Just as a follow-up, I know we've heard talk about experimental treatments. This is not that experimental treatment. There's another experimental treatment being used to treat them?
Yes, there's another experimental treatment that's been given as well, and we've been asked not to release the name for a number of reasons. One is we have no data. Some of our blood tests have been sent to the CDC for analysis, so hopefully in the relatively near future, we'll have some information.
Debbie, I'm curious what it was like for you when you found out Rick had Ebola, and just how you and your family have kind of held up through this process of not being able to see him, or, you know, through a miracle,
Right.
not being able to see him or interact with him.
So he was in Liberia, and it was Labor Day weekend, Friday night, so that would be the 29th, right? And he, actually, I don't think he told me that night. I think Saturday morning he told me that he had been running a fever and he was worried, that he was treating himself for malaria, just in case, and in hope that that's what it was. But after, and we were texting and talking a little bit, but mostly just messaging one another all weekend, monitoring the fever, discussing, you know, the events of the week, I guess. And we were scared. We were scared what it might be. He spoke to the boys on Monday afternoon while he was waiting to get his test. He couldn't test until Monday morning because you often have a negative if you do it too soon. And so he had to wait until Monday to test, and they came and took his blood. And he, later in the afternoon, he's saying, this has been the longest day of my life, waiting to hear. So he had chills and fever a lot over the weekend, took some Tylenol to try and could at least be comfortable. And especially all weekend, he was making sure he was staying hydrated with homemade oral rehydration serum, or what you call it? Solution, that's the word. And which he's a big fan of when there's, you know, when you've got problems. And that, I think, the doctors felt that really helped him when it came time to when he arrived, that his electrolytes were manageable. And so it was scary, but I think that when he went away at the beginning of August, we had already discussed that this could happen. I think I had faced my worst fears when he left, and we were. I was very hopeful, I would say. I think my brother-in-law called it optimistic denial, because they were having survivors at the treatment center in Monrovia. And not that they necessarily really know what the secret is to why some people are surviving and some people are not. But I think I was in a really different place than the Brantleys, where they had already, they had seen almost only one survivor, I think, when Kent had gotten sick. And so I think that I had a little bit of, and I'm maybe a little bit more of an optimist than I should be, I guess. So I was thankful. I was really thankful when the evacuation could happen so quickly. The earlier one took so long that it all happened so fast. I think we hardly had time to be too afraid. So
I just wanted to add that Rick has been greatly helpful to us as a physician going through this disease. We don't know much about it, but he's able to now very clearly articulate what symptoms he had, when, and what the timing was. So we're learning not just by watching him and treating him, but also by his descriptions, because he's a physician. So he's helped us back.
He said symptoms starting that Friday.
he said it was Friday evening, the 29th, was when he first began to have a fever in the, just above 100, I think. And I think it was Sunday when it finally got over what they consider probable for Ebola. I don't know if it's 101.5 or 102, something like that.
Debbie, Christina
Yes.
with Channel 7.
Hi.
Hi. Tell me, what was going through your head? What were you thinking when you finally got to the point where you're realizing that we really couldn't do this?
Well, I guess just being thankful and knowing, I think more than anything, just knowing that this is going to be a platform for him to be able to speak out on behalf of the people who are suffering over there, and who, quite frankly, were ignored for the first 6 weeks that this was going on. And I know that he would hate all this attention, but if he can use it to make sure that that resources are used well in Liberia and in Sierra Leone and Guinea to help lick this thing and build up the healthcare systems so that they're not at risk of this kind of disaster again, that he will do everything he can from here on out to make sure that that's true. He would say, this is not about me. This is about getting the job done. So, does that answer your question? All right.
Chase Bob with the local NBC. Tell me about, you mentioned in your statements about the mission to really bring the medicine to the area. Talk about have you been able to talk about the current state of helping this outbreak in terms of where it's standing? I know you guys are-
I'll be honest with you, since this all happened, I'm pretty out of touch with what's going on there. The only thing that I can tell you is that so when Rick got sick, one of the doctors who had taken care of Nancy Wright-Ball and Kent Brantley, he had come to the States, he had rested, and he was ready to go back. And he got on the next plane, I believe, out of there, and arrived before Rick had evacuated, and he, in fact, helped Rick get in the ambulance and get to the plane. So the idea is he picked up where Rick was leaving off, basically, and they were redesigning the intake area of the hospital so that they could especially begin to see pediatric patients and get them on the ward if they needed to be. But they needed a stricter triage system. And so Rick had designed that the week before. I got an email this morning from Dr. John Fankhauser that they were finishing up the construction work on that today. So hopefully by next week, they will be able to get that in place. But there's just a whole new set of procedures and ways of doing things that they have to come up with to protect themselves from exposure. So, so that's all I really know at this time.
Do you think he knows how he got it yet?
You know, I knew that question was going to come up, and here's my answer. It was investigated by a team in Liberia. I think a CDC team is investigating exposures and such. I honestly do not have details about what they found out and what they figured out. They do believe, I'll say this, they do believe it happened at the hospital in an emergency situation, but up to this point, no other hospital staff have become sick. So I don't know. So that's all I can offer you on that detail.
Two-part question. First, doctor, the term steadily improving has been used. Is there a chance of a relapse, or is this pretty much it will consistently mean steadily improving until he's cured?
Well, I think we're on new ground here. I would say that given his remarkable improvement over the last few days, I would think a relapse would be less likely. But again, since this is a completely new situation, he is different from the patients at Emory. He's different from any other patient, essentially, in the fact that he's received this investigational drug along with the convalescent sera. So there's really no way to tell, but I can tell you his progress has been remarkable.
And, Sacra, if your husband, as a wife, if your husband says he wants to go back, what will you tell him?
I'll probably say the same thing I said when he went the first time, and that is, I know where your heart is. And besides, now he'll have immunity. So, but I'm sure that when he gets his strength back, he's going to be ready to go back. And I think that I will have to allow that. So it's where his heart is. He loves Liberian people. He loves Liberia. He loves taking care of the old people. He loves taking care of the babies. He loves joshing with the young men and the young people. They say that he is a Liberian with white skin. So.
Can you talk about what it was like to be able to communicate with him and see him for the first time coming here to Omaha?
It really, yes, I got choked up doing that because he went into the unit on Monday night, and I talked to him on the phone as he was waiting to enter. They were preparing his bed and such. And Tuesday morning, I think I heard from him by email or text or something, and then I did not hear anything till the next morning. I think the mission had heard that he had had a rough day on Tuesday, but I didn't hear his voice. I didn't get a message all the way through Tuesday, through Wednesday. I think he finally called sometime on Wednesday, and he had about 3 minutes worth of energy to talk. In fact, I was on another call, and he called, and my son answered it, and talked to him for a minute, and then my son said, "Dad says you better hurry." He's not going to be able to talk long. So, and then on Thursday, I heard from him as they were starting to get him ready to suit up for the evacuation, just a text message. And then Dr. Fankhauser called me after he was on the plane. So those days were really pretty rough they were busy because I had news media outside my door all day, but they were hard to not hear from him. And so those, it was nice that over the weekend we were in good contact, but it was a little scarier after he was sicker, obviously.
Kimmy, you said you got choked up thinking about that. You also got choked up when you started reading the statement about his petition. I know that people, when watch loved ones recover, they have certain milestones. Since Friday, can you kind of give some of the milestones that you've seen emotionally and
When we first talked via the teleconference, he was very pale. His eyes were red. He did not have a lot of energy. It was really just more that he wanted to see my face. This was Saturday, so and I was happy to see his face. And you know, later on in the evening, the second teleconference, he says, "You talk," because he didn't even have the energy to say anything. But every single day, you know, the first 2 or 3 days, he was very slow to respond, slow to get his words together, to say something. He was quite emotional. I would tell him things that happened, you know, things that people were saying, and he would get pretty, you know, emotional about it. Then, I mean, as Dr. Smith said to me this morning, it seems like his brain is waking up a little bit more every day because, you know, even they could see, I think it was, let's see, today is Thursday. So Tuesday, they said he was sharing all his notes with them. To tell, you know, talking about the course of the disease. And this morning when I talked to him, I would say he was mentally like 80%. Just really, you know, much more his usual self, especially in that sort of Skyping context. You know, it's always a little awkward and strange. So, right. I think their main goal right now is to get him to eat more. He he's had a lot of, some of it has been stomach upset, but more of it has just been things taste funny or the texture is funny. So, so the goal really in the next couple days, I think, is to get him to find things he can eat so that he is eating more normally and get some calories. So.
You said earlier in the week, or you reported earlier in the week, saying that he had a rough reaction to that experimental drug, and then it's gotten better since then.
Yeah, I think it's fair to say the first, he was sicker, so it's hard to know for sure what was responsible. And he had electrolyte abnormalities, fluid problems, and that's the time we were administering his medication. So it's hard to know what caused what, but he seemed to be tolerating each dose subsequently better, and he lately has had no reaction to it.
Was it every day that you were giving?
We're giving it to him, yes, roughly.
And the blood treatment that was given just one time?
There was two separate occasions, Dr. Brantley's blood.
What did that do? What effect did that?
Oh, it had no effect. It was like he was eating chicken soup.
As far as disease is what are you hoping that?
Well, I think we're hoping it jump-started his immunity. So this is a very serious viral infection, and to survive, you have to build up enough antibodies to neutralize the virus. And since most people don't survive, the virus multiplies faster than the immune system can respond. But we're hoping to buy him some time, and in other words, give antibodies to help his immune system get started battling the Ebola virus and let him get ahead of the curve. So there again, he seemed to respond nicely to those and certainly tolerated them. I don't know how much of his recovery is due to the drug, how much is due to the convalescent serum, and how much is due to aggressive IV fluids and other medications to help him. Certainly, we want to thank the critical care medicine anesthesia team was spectacular with taking care of a very sick person.
We do have some folks listening in on the phone, and we'd like to turn things over to them if they would like to pose any questions. So feel free to do so now. If they can hear us.
This is Michelle Cortez from Bloomberg. I'm wondering if you guys could identify yourselves first and then tell us what the treatment effect or what the treatment has been. We're kind of getting some crunchy information through the phone. We can't hear it exactly. It sounds like maybe some blood transfusions from Dr. Brantley and then an experimental medication, wondering how often he got that and what type of fluids and whatnot. Thanks.
So this is Dr. Angela Hewlett. I can tell you that he received 2 doses of convalescent sera from Dr. Kent Brantley. He's received an experimental drug for every night, actually, for the last several days since his arrival. And he's also been receiving a lot of what we call aggressive supportive care, and that is IV fluids, nutrition, supplements for his electrolytes in his blood, things like potassium, phosphorus, things like that are important to maintain the sort of integral functions of the body, cardiac function and such. And essentially what we've been doing now is just supporting him through this.
As a follow-up to that, what signs would you be looking for to decide whether or not to have Dr. Brantley back to have another treatment? And as a follow-up, also the medical treatment, I guess why aren't you trying the experimental drug?
Well, I'll take that. This is Dr. Phil Smith. First of all, the milestones are clinical, laboratory, and others. So, for instance, we're hoping to have data back from the CDC on how much Ebola virus he had in his blood at certain times through his hospitalization, and that'll help us. And seeing how he does clinically. And as I mentioned, I've been asked not to disclose by several parties, not to disclose the drug, I think, for a variety of reasons. One is that we don't have the data yet. There is very little short supply. We don't want them to create a feeling that this is a cure-all. We don't know whether this drug had any impact at all. It might have. He got better, but he got plasma, he got aggressive resuscitation. So we think it'd be premature to speculate about what the drug is and what its effect was.
Could you talk a little bit about the effort to document the treatment and get data? And, I would say you're in new territory, and what are you doing to figure out if any of this helps and maybe help future patients?
Well, that's a good question. These new drugs all have rigid protocols that the FDA enforces, and so they all require extensive testing of blood parameters so we can see, for instance, if any kidneys are injured or liver is injured or there's anemia or any side effects. We're also measuring the amount of virus in the blood and other tests like that, biological markers that will help us decide whether it was effective or not.
But it sounds like it'll be difficult to tell of the treatments you're doing which had an effect or how much of an effect was from the blood transfusions or from the drug or from the other care you're providing.
That's legitimate criticism, but we decided we're more interested in saving Rick than trying to have a pure study, so we just administered everything we had access to, basically. And we're hoping that our experience plus the Emory experience with ZMAP will begin to pool enough information that we can start to get an idea about which drugs could be effective.
Doctors, how much longer is this line of treatment going to continue for?
We're reassessing that on a daily basis, and it's really going to depend on his progress. Right now, we're encouraged by his progress, and as you've heard from Debbie and Dr. Smith, that he is doing a lot better clinically and on paper in his lab work and lab parameters. But again, we're really taking things day by day here, and I think that this is, as I said, sort of a brave new world, and he is his own patient and different from all the others, and so we really have to assess on a daily basis on our various therapies, including the investigational drug.
Do you have any indication that the system is responding and actively fighting the virus?
No, again, that's laboratory data we don't have back yet, but that's information. So at some point, in the case of the patients at Emory who may be different than Rick, it was almost 2 weeks from now before they were able to say that the blood had cleared completely of the virus, and then they released the patients. He may do it faster, he may do it slower, we're not sure.
2 weeks from now, so 3 weeks from the stroke.
Right.
Are you able to say how long has it between the blood transfusion happened or the addition of blood before you started seeing what you perceived to be good results or just getting better?
I would say he started, the first day was pretty rocky. You weren't here for that, you did.
Yeah, I missed that day. I was stuck in Chicago that night.
That's just as well you missed that. But then the second day it was enough better that we still had some abnormalities, certain tests and organ systems and so forth. And then the third day, I think maybe is the day that we started saying, well, we really like the way this is going, and each day it's been picked up. Dr. Hewlett had the benefit of talking directly to one of the physicians in Africa about their experience. Obviously, they don't have the treatments we do, but they take care of a lot of patients. And physicians who treat Ebola have talked about honeymoon phase where the patient looks good, and then later on they deteriorate markedly. So that's why we're a little guarded. We don't anticipate that happening, but we are being careful about it. Do you have anything to add on that?
I will say that the physicians in Africa, though, don't have anything to go with that honeymoon phase. They have no lab work. They have no parameters like what we've seen. And so they can say that clinically that's what they've observed. And clinically, we've observed him improve on a day-to-day basis. But we also have lab parameters to go with that. And those are also showing improvement, which is very encouraging.
At what point wouldn't he have to be, or he could come out of isolation? Is that based off labs, or is that based off how he is, in person? How do you decide that?
No, I've had phone conversations with the CDC, and they've got some very rigid guidelines. You need a PCR test to be negative, meaning there's no virus in the blood, and you need 2 tests at least 48 hours apart that are completely negative before the patient's considered cured and non-infectious. Now, if he didn't have Ebola, if he had the flu, we might send him home earlier. I could imagine a scenario where he'd be well enough that with a little bit of home nursing, we could send him home in a couple of days maybe. But because of the disease we're dealing with, the CDC has pretty much told us that we have to meet these markers in order to release him. So I think he's going to get pretty restless.
Doesn't the isolation unit also protect him from any secondary infections?
Yes, but people in hospitals can get infections from IVs or catheters and other things. So it protects you from external infections, certainly, but not from internal ones.
And Debbie, you've been able to teleconference, but how hard has it been to not be able to hug or
Hold his hand, yeah, that's hard. That's really hard, but when you weigh it in the balance of the fact that he's alive, you can put it aside. So.
Debbie, have the boys been teleconferencing?
So let's see, I guess it was Monday night, that was the first time he was able to talk with our 2 sons who are in Massachusetts. And then last night he was able to talk with his brother and his father, his elderly father. So.
For the doctors, I just got an email from Dr. Nancy Snyderman's producer asking what you did to Dr. Brantley's blood to make it to serum, or was it just a straight donation?
Yeah, it was a straight donation. We went through the blood bank here, and we tracked him down to blood typing, and then they collect whole blood, and then through a filtering process, get rid of the red blood cells, so you have plasma. We transfuse plasma.
So Nancy wasn't a match, right? You mentioned that earlier.
Yes.
So you tried her first?
Well, yes, we did, because we said we're looking for all the help we could get, and we were able to get hold of her first. Actually, SIM was very helpful at locating these people and helping to find out their blood types. They had a lot of information already. So.
How much time passed from when Kenneth gave his blood to when it was in Dr. Sacra?
Oh, I'd say it was a matter of minutes to hours for the first dose, and then the second dose we gave the next day.
And that was Saturday?
Yes.
Or was it Friday?
First time you gave it was Saturday morning?
We gave, was it Friday or Saturday?
We gave it Saturday.
But he was
Saturday
here.
and Sunday.
He
He arrived Friday, and then, that's right, we got the first unit was Saturday, and the second unit was Sunday.
Did that blood donation show high levels of antibodies to the Ebola virus? Were you able to test it in Dr. Brantley's blood before?
No,
No.
we did not. We didn't have time for that, so we just presumed, we knew it was compatible, it would be safe to transfuse. And we talked to Debbie and we talked to Rick, and we said there's always some risk with a transfusion, and we don't have time to run the tests on levels of antibody, but chances are good that there's going to be some significant amount of anti-Ebola antibody in there.
Will you do follow-up testing then on this to find out?
That's a project we're working on with the Emory people, trying to create a list of who's got what blood type and who could potentially donate.
So you're working very closely with them and doctors. Are you also monitoring electrolytes and is it any doctors doing?
Yes, definitely, very closely, on a daily, if not more than that basis. We've noticed that that's been a big part of this disease is the electrolyte imbalances that occur, and electrolyte imbalance can lead to a lot of severe complications. And in Africa, they don't have the ability to test for those things, so we don't really know what goes on as far as how high the potassium or low the potassium level is, and how low the magnesium level are, and that sort of thing. So here we have that ability, and so we're able to monitor those electrolytes and replace them as needed.
What complications arise from that?
Mostly cardiac problems, cardiac arrhythmias, irregular heart rate, things like that, which could be a big factor in this disease. It's not something that we know a lot about, but again, because they can't monitor that sort of thing in Africa. But here, we've been able to monitor him very closely and give him what he needs so that we avoid those problems.
I want to check back with the folks on the phone to see if there are any other questions there before we start to wrap things up here.
Hello?
Feel free to ask any questions.
I was wondering, could you just sum up from a medical point of view what his condition is now? I mean, we've heard bits and pieces throughout this conversation, but it would be nice to sum up where he is. And a second little question is, on what basis is this experimental drug being given? Is it an individual experimental IND, or how was that arranged?
Yeah, any drug you give has to go through an IND, in this case, emergency IND. And all that just means it's a drug that has shown promise in the test tube and promise in animals, but it hasn't been thoroughly tested. And in the case of some of these drugs, they've been able to get into human volunteers to look at safety. What was the other question?
As far as his condition goes, I can tell you that he's been improving on a day-to-day basis. We initially said he was stable, which means that his vital signs are stable. However, that has improved significantly over the last few days. I would say he's in good condition at this point. He is able to maintain some food intake, and he is able to get up and move around his room and communicate and read magazines and really getting back to his normal self.
He's not able to take in enough calories to support himself by mouth, so he's being fed through an IV.
And he tires easily, and he's weak. Yesterday, they set up an exercise bicycle for him to try and get some physical activity, and he did it. Well, they had like a chair set up so it was recumbent. He did it for 10 minutes yesterday, and today he told me that was overdoing it. So this is someone who could ride between 15 and 35 miles a couple times a week at the end of July. So he's definitely lost physical condition since then. So I think that'll take a while to come back.
And that's start to wind things down, maybe 3 or 4 more questions.
You said he had a rough trip over in Liberia, that sort of thing. He was able to walk out of the plane when he was taken out.
All I know is that they had to sedate him. And, it's not an easy trip when you're okay. So they said that he got restless, and so they had to sedate him. So I don't have a lot of details on that, but.
How are you feeling now? A sense of relief?
Oh, yes, a great sense of relief, but just grateful, so grateful to the Nebraska Medical Center for how well they've taken care of him, and just how invested they've become in his recovery. Grateful to God for answering the prayers of so many people, and burdened that this not really just be our own story, but a story of ourselves and our people in Liberia as well. So,
Debbie, we had seen the first picture of you and Dr. Sacra kind of communicating through the video conference
oh, yes.
yesterday, and you were reading Bible verses.
Yep.
I'm wondering, can you tell me at all for any of these video conferences, what verses you're reading, what those mean to you?
I'm sure let's see, I think the first day I read Psalm 20, which was a psalm that the Lord put on my heart. It was one of those, open your Bible and this is what you read days. and that is what came up, and it seemed to, really speak to me. John 14 was the teaching at my church on the Sunday that I knew that Rick was sick, but we weren't really telling anyone. And there were some verses in that. I think Christ said, because I live, you will live. And it was, it just seemed to touch me. But there were other verses in that as well. And then yesterday, I read Philippians 1 and 2. And that is, some of that had been on my heart when I gave my press conference last week. And I used some passages from that. So those have been where I keep going back to myself. So I was sharing those with him. So those are mine, not necessarily his favorites. He hasn't said, "Oh, please read this." So I got to have my own ideas about what to read this week.
This is the last one.
Doctor, you know that Emory University helped you and taught you things about treating Ebola. With this patient, are there things that you have learned that they didn't know that you can help them with their new patient?
Yes, we've been on the phone. They've been very helpful. I called them daily for the first several days before Rick showed up. We knew he was coming, and frequently throughout his stay. And they have another patient now. They've called us and been in contact. In fact, one of their nurses is going to visit later in the year. So there's been a mutual exchange, and trying to figure out a number of lessons learned in terms of treatment and complications. And I think the only way we'll do this is by pooling our data, because this is so far the limit of the experience of Ebola care in the U.S.
I'm sorry, Taylor, just a quick procedure. I just wondered, am I correct that Dr. Brantley and Dr. Sacra were able to talk via video conference?
No.
Do we have pictures?
No, they were not, because, they tried, but Rick doesn't remember it. He doesn't remember that they did that, because Rick was so out of it. So I think Kent, I wasn't here, but I think Kent spoke to him and told him that he was praying for him, but I don't think that, but Rick does not remember that he was here. He says, "Was Kent here?" So.
Maybe again in the future?
I'm sure they will. So I'm sure they will. They're very close. So, I wanted to just clarify something about the Bible readings that I read and what I quoted, and that is that I really want to say that, the things that are in those Bible verses, you could read them as though they are, rock solid promises about living a physical life. But I think that really for us, that they were an assurance that no matter what happened in the situation, that there was still life. So I don't want anyone to misconstrue, because, a lot of people are not living as a result of this. And so we thank God for Rick's life, and we know that Rick will do something good with the life that he's given. But we are mourning for all of those who are losing loved ones as a result of this terrible virus. So thank you.